Healthcare touches every single one of us. Whether you're a patient, a caregiver, a medical professional, or simply someone hoping to stay healthy, the decisions and systems at the heart of healthcare affect your life in profound ways. Yet, when we look closely, it's clear that some of the most crucial questions remain unasked or unanswered. Today, we're going to dig deep and challenge the healthcare industry by asking those difficult questions. And along the way, we'll explore how artificial intelligence and innovation could finally help us find solutions that have long seemed out of reach. So, why does this matter to you? Because healthcare isn't just about hospitals, doctors, or insurance cards. It's about people. It's about your family, your friends, your community, and ultimately, your own well-being. At AI Healthcare, our mission is to make healthcare clearer, smarter, and more affordable for everyone. Today, I'll raise 5 bold questions about healthcare. Questions you've probably wondered yourself, but rarely hear discussed openly. By the end, you'll see how asking better questions can drive real change. Let's start with the first and perhaps most pressing question. Why is healthcare still so expensive, despite all the technological advances we've seen in recent years? Think about it. We have electronic health records that make information sharing easier, telemedicine that brings doctors to your living room, AI-powered diagnostics that promise faster and more accurate results. Yet, instead of reducing costs, we often see prices going up. Where is the money going? Are administrative costs, insurance complexities, and fragmented systems eating away the savings that technology should provide? Or is it a matter of profit-driven models overshadowing patient-focused outcomes? The promise of innovation should be affordability. But if every new tool adds another layer of expense, we need to ask, how can we steer innovation toward actually lowering prices, making care accessible to all, not just to those who can afford it? That brings us to our second question, one that gets to the heart of fairness. Why do patients with similar conditions receive vastly different levels of care depending on their location or insurance status? Imagine 2 people, both in need of the same medical attention. One lives in a city with world-class hospitals and has excellent private insurance. The other lives in a rural area, hours away from a specialist, and relies on public coverage or pays out of pocket. The difference in outcomes can be staggering. Shouldn't quality care be a right, not a privilege? What policies, technologies, and digital tools could help level the playing field so that your zip code or income no longer determines the quality of care you receive? Telehealth, mobile clinics, and AI-powered triage systems could help, but only if they're deployed with equity in mind. It's time to rethink the way we deliver care, ensuring equal access for all. Our third question gets to transparency, the kind that puts power back in your hands. Why is data transparency in healthcare so limited compared to other industries? When you buy a car, you can compare prices, safety ratings, and reliability. When you book a flight, you know the cost up front and can read reviews. But in healthcare, patients are often left in the dark. Prices are rarely clear before treatment begins, and success rates or safety metrics can be hard to find or understand. This lack of transparency can leave people feeling vulnerable, frustrated, and powerless. Could artificial intelligence and secure data sharing change that? Imagine a world where patients can easily access real prices, compare outcomes, and make informed decisions about their care. Open data could create healthy competition and raise standards across the board, if we're willing to ask for it. Next, let's talk about prevention versus treatment, a question that could change the entire foundation of healthcare. Why is preventive care so underfunded compared to treatment? The evidence is clear. Investing in prevention saves lives and cuts costs. Regular checkups, screenings, healthy lifestyle programs, and early interventions can stop diseases before they start. Yet the system still rewards reactive treatment over proactive wellness. Why? Is it because prevention is less profitable? Or because our policies and reimbursement models haven't caught up with the science? Artificial intelligence could shift the focus, using predictive analytics to identify risks, personalize wellness plans, and catch problems early. But unless we reward prevention, we'll continue to spend more on treating illnesses that could have been avoided. Finally, our fifth question looks toward the future. Why isn't AI and digital health being adopted faster to reduce costs and improve access? We already know that AI can detect diseases earlier, automate paperwork, streamline workflows, and personalize care for each patient. Telehealth apps can connect patients to specialists no matter where they live, and digital dashboards can help manage chronic conditions. So what's holding us back? Is it regulatory hurdles, slow-moving bureaucracy, lack of training for healthcare professionals, or perhaps a deeper issue of trust between patients and technology? The benefits are clear, but adoption is slow. If we want better care, we need to speed up the responsible integration of AI and digital health, ensuring that safety, privacy, and human values remain at the center. These 5 questions about cost, equality of care, transparency, prevention, and the speed of AI adoption aren't just complaints, they are opportunities. By shining a light on these challenges, we challenge the healthcare industry to do better. We invite innovators, policymakers, providers, and patients to join the conversation, to rethink old assumptions, and to harness the power of technology for the benefit of all. Imagine a future where healthcare is affordable, transparent, preventative, and accessible, driven not by profits, but by the needs of real people. So, which of these questions resonates with you the most? Is it the struggle with rising costs, the injustice of unequal care, the frustration with hidden data, the need for more preventive solutions, or the slow pace of AI adoption? Think about your own experiences, your hopes for the future, and your vision of what healthcare could become. Share your thoughts, your stories, and your ideas, because real change starts with hard questions and with people bold enough to ask them. Thank you for joining us as we challenge the status quo and push for a smarter, fairer, and more compassionate healthcare system. Stay curious, stay engaged, and remember, your voice matters. Together, we can build a healthier future for everyone.